When people come to us here at the Implant Center, there's all different levels of treatment needs that we discover together with the patient. And today I wanted to share with you one of the simpler ones, believe it or not, is just when somebody comes to us with one tooth that's broken, non-restorable, and we need to remove that tooth and we want to rebuild it back. And so in this case that I have today, we have a patient where their tooth on the upper right in their smile zone, just behind the front teeth, was broken and to the point of being non-restorable. So in that process, we started by ideally in one single visit, we take the tooth out and we place an implant in there and get it started. We usually do some bone grafting with that, get them started healing. And at that point, we typically have about a 3-month wait before we will go in and build the tooth. In that 3 months, if somebody needs a temporary tooth in that space, we build one for them. But in the case here, you can see that they have the broken tooth in the top picture, and then the second picture down shows what it looks like when an implant is in place and it hasn't been restored yet. What you're seeing there is called the healing cap. And as I go to the next page, in the top photo, you can see the broken tooth in the top photo, and you see what it looked like in their smile zone before we got it fixed. And now you can see the after, and you can tell that the tooth is now fully restored and back in place. And ideally, it's our little secret that they ever even had that tooth replaced at all. We want to try to replicate nature and create something just as good as new. If you're wondering what those blue marks are, that's when we check the bite to make sure that the bite fits together properly. We make sure the contact points are exactly perfect. It's all about the engineering of what we do. So those marks are still on there. We just didn't wipe them off before we took that final picture. But a great outcome, because if you saw the after picture first, you would barely even ever be able to tell that they had lost a tooth at all. Again, our little secret.